we do know, regrettably, that if COVID enters an aged care facility, then it's a significant risk to everybody. That's why all along we've known that the low rate up to now of COVID in aged care was because of the low rate of community transmission. With higher rates of community transmission, it's coming in with staff, and part of the problem is that staff are coming in, they're asymptomatic, they don't know they have it, and then they're working, and at the moment, sometimes across more than one facility.
So how is that allowed to happen, Ian, if that is the case?
Well, what I'm saying is no one knows that the staff member has COVID because they're asymptomatic. And then if there is an outbreak, if they're lucky they catch it early, there are a lot of the homes that have it have only a few cases and are on top of it. But there are some where clearly it has got away, and that's the danger. And the problem is, of course, and we know from around the world, that older people are particularly susceptible. This is also a disease that has no treatment. And that's the dilemma. You know, there are measures you can take with other diseases, but there is not a clear treatment. There's amelioration, but there's no treatment.
So what's the answer here? I mean, do you have to stop the movement of staff members, just restrict single staff members to single aged care facilities?
Well, there has been an agreement negotiated between aged care providers and the unions to do that, and the federal government has put the money behind it, so that if there are extra costs involved, neither the staff member nor the facility will be out of pocket. The federal government has set up this response centre, unified response centre across both levels of government, bringing in people with expertise in handling emergency situations. That's a very good initiative by the respective federal ministers, Minister Colbeck and Hunt, and the department, and hopefully this is going to see coordination. Look, some of the homes are clearly managing this well, others less. We hear conflicting reports about the degree of preparedness of some staff for infection control. We know that this sector has variability in quality in terms of its management and governance, and that regrettably some of that will show up. But can I just underline for your viewers again that the fundamental risk factor here is the degree of community transmission. If there's not COVID in the street, it can't be in the nursing home. And that's the risk, and that's why Victoria has to get this under control.
Well, you mentioned the PPE there, and there is that report in the Herald Sun this morning, Ian, that suggests completely insufficient levels of PPE. So 1,300 providers had asked for access to stocks. That was back in May. But then the Department of Health said that facilities should have sufficient levels on hand, which seems to suggest that those facilities are unprepared for this. So are they, in your opinion? Are they unprepared?
Well, as far as we are aware, the Commonwealth has made many millions of masks and other PPE available, and I am not hearing that any provider that's requested it is not getting it. If there is an issue there, then this response centre ought to sort that out pretty quickly. But, you know, the Commonwealth has very substantial supplies. I don't think it can ensure that every provider is stocked up for weeks ahead, because it needs to switch the PPEs around to where they're needed. But people have been supposed to be compulsorily wearing PPEs, masks in nursing homes in Victoria for a couple of weeks now. So, you know, I'm surprised to hear that there is an issue. If there is, this response centre should fix it, I hope.
Is that response centre too slow? I mean, have we not learnt the lessons of Newmarch House?
Well, I think the response centre was an important initiative in the overall context of Victoria, and I hope that that will mean that they can do some more preventive work. I mean, the only other route that we can go now, I think, we talk about nursing homes being in lockdown. They're not in lockdown, they're just locking out families, and there certainly are some issues about communication with families as well, and care of residents who depended on those families. But the only other alternative is a route that was done with some health workers early on, which is actually to lock down and isolate aged care workers.
And do you think that should be done moving forward? Well, and if someone becomes infected, should all people who have become infected in aged care centres be now moved to a hospital straight away?
Now, I think the issue with most people are going to hospital, but the issue is, will the person actually benefit from going to hospital? The Commonwealth has certainly put in place not only the potential for hospitals, but alternative facilities where they need to isolate. In some nursing homes, the layout means that infection control is very difficult, and it's important to get those who've tested positive out, but not necessarily into an acute hospital, which is not necessarily the best environment. And there has historically been an issue with aged care homes shuffling people off to hospital when it's not in their best interest.
You'd have to think, Ian, that with 550 active cases, that the death toll will almost certainly rise and perhaps even considerably.
Those 550, of course, include staff. So roughly, I think figures I saw were 260 residents. But yes, you're right, regrettably. The vulnerability of very old people with other health issues, which is why they're in the nursing home, their vulnerability to COVID is the most extreme, and it is very, very worrying. And everybody needs to put more than maximum effort into ensuring that they're doing the right thing.